Hi, I'm Dr. Bipin Sangha.
And I'm Dr. Eleanor Clark.
After last year's successful Imagine campaign for new medical imaging equipment, we're excited to show you all the new upgrades to PSARC's medical imaging department.
These improvements would not have happened without your support, and we are endlessly grateful for all that you have done. This is our new mammography and breast tomosynthesis unit. The advantage of this new unit is that it reduces the dose of radiation for the patient. It is ergonomically better in that it's more comfortable for the patient. And thirdly, it gives a much better image. It is easier to diagnose abnormalities in the breast, and in particular in women with dense breasts. And this is a very important concern at the moment. It's like a CT, and we take a series of x-rays. The tube moves through an arc of 15 degrees and takes many x-rays, and we can scan through it like going through the leaves of a book, so we can see each layer of the breast and look for lesions that may be hidden that were otherwise missed. And we can problem solve areas that otherwise would require additional imaging with ultrasound or MRI, or they would require a follow-up exam in a few months' time to see if the abnormality persists. And we can actually problem solve and have a much clearer idea whether there's something significantly there or not. Overall, it's a fantastic unit, better for the patient, better for the radiologist, better for everyone. This is one of our 3 new ultrasound units. They're all the same. They're all replacing units of different vintages and different companies, and they all are technically superior to what we had before, many more capabilities, very user-friendly for the technologist and for the radiologist. And we can do little video clips, cine clips we call, through the body, which is very helpful for us. These units are portable. These units can go up to the ward, and they can go up to the intensive care unit, which allows us to image patients that aren't able to come down to our department. And just the scope of work that we can now do with the ultrasound is amazing.
This is our new digital x-ray machine. It does a huge amount of work for our department. The main things we use it for is things like broken bones and pneumonias in the chest, and more broken bones. The biggest advantages of this machine when compared to the machine that it replaced is, one, there's a less dose. It's a bit faster in how it images and acquires images. And probably the most biggest thing is that it's much more consistent imaging. And what that means is that we're not having to repeat x-rays to make sure that the image looks appropriate. And overall, for our patients, that means less radiation dose. That means reduced wait times. That means we can image more patients every day. And overall, it's just been a huge difference maker to our department. And we couldn't have done it without the donor support that makes all of this possible. This is our new fluoroscopy machine. It's a major upgrade from what we had previously. It's allowed us to do a lot more new procedures. I personally have done procedures like chest tubes in patients who, with a collapsed lung, who needed the procedure right away, brought in just directly from the emergency room right to this machine. We've done spine work and lumbar punctures, which we weren't previously able to do because the imaging quality on this machine is just so great. And what that really means is that we're able to keep patients at PSARC Hospital instead of having to send them out to other hospitals. And that's really a huge benefit for those patients and the hospital itself. And none of this would be possible without the donor support.
So much has been accomplished, and we are so very grateful. However, we're not done yet.
Our next goal is to welcome a new MRI and a gamma camera to PSARC Hospital to complete our promise to you.
Thank you again for your commitment to deliver the highest quality care to our community.